Sean Duggan now, who's the Chief Executive of the Mental Health Network, which represents NHS-funded providers in the UK. Hello, Sean. Afternoon.
Hello, good afternoon.
Hello. Now, I know you're not here to represent the government, and as Anna's just said, those people who are working are doing an incredible job, but there just aren't enough of them. What is the government doing to make this better?
So first of all, I'm really pleased that Anne has shone a light on this particular issue. She describes the sort of current demand very well. I've been in managing mental health services for nearly 40 years. I used to run child and adolescent mental health services over 25 years ago.
Is it better or worse now?
And it's there's more demands now. That's for absolute sure. But the services have always been pretty poor, so we really do need to tackle it now. Now is the right time. And that government statement you just heard there, we've got to start unpicking that and trying to get reassurance from it. So you asked me what's being done. There is currently a plan for mental health services. It includes, as a priority, child and adolescent mental health care. There's no question that the politicians, that government, that NHS England see this as an absolute priority, the number one priority in mental health. It has to be. If we don't look after our children in society, we've got it very wrong. So there is some money coming through now. It's about 2.5 years into the plan, and there's a 2.5-year period to go. There will be some improvements, and made reference to some good services, and we're seeing those being developed on a weekly, on a monthly basis, and it's very good to see that. But it can't stop there. That will only improve the services to a small, it'll be better, but it won't be a significant sea change. Now, the public know now that there's going to be a long-term investment plan for health. What we do need to make sure is that that has the proper allocation for mental health, and that this service, child and adolescent mental health care, gets the right allocation. And I'm hearing positive things from government. We will lobby very hard to make sure that continues. So there's our opportunity, because I hear George's story. I represent organisations that try to see George quicker than that and give him proper help. And of course, nobody wants
quicker than 2 years, wouldn't you?
Yeah, sort of in weeks, days and weeks. Nobody wants to be in this position, but it is a question of resources, and it's also a question of workforce, to make sure. You'll be speaking to psychiatrists in a minute, to make sure that we have the right amount of child and adolescent psychiatrists and specialist nurses. This is a complex area, ranging from mild to moderate mental health problems to very complex, severe problems where children need some time in a hospital, and all that needs to be covered.
You're right, and you're right to shine a light on that as well, because we think of mental health in a way as being different to physical health, but look how complex and different physical health is. Mental health is exactly the same as that. But yeah, we look at the funding, and we're just looking at the numbers. 1% of the NHS budget is spent on mental health. That's not children's mental health, but mental health. 1%,
and 6% of the mental health budget on children.
And 6%, and then
despite the fact they're 20% of the population, and most mental health problems start to develop in childhood.
You might think that's a lot of money. Still, 1% of the NHS budget is a lot of money. But when you look at 1 in 4 of us will have a mental health issue during our life. 10% of the NHS budget is spent on one condition alone: type 2 diabetes. 1 in 17 people have that.
And what we do know is that for not a large amount of money, some spectacular improvements can be made. So just a quick example: the North East London Foundation Trust here in London had a child and adolescent mental health inpatient ward, which is very poorly rated by the CQC. In 1 year, they turned it round to an outstanding, and I've been to see it, and it's absolutely excellent. And they have a home treatment community team as well to back it up. And there's an excellent charity called Place to Be, who provides services in schools, and mentioned that. That is another part of the government plan that has to be implemented, because we can pick up things early in schools.
I think I agree. Schools is the place to start. It sort of all comes down to early intervention and prevention. If you can tackle it in schools and tackle it early, before we have to get to the services, these waiting lists will start to drop, because they're being tackled earlier in their lives when they're younger. If they start understanding more about it, I think personally they should be teaching this stuff in schools. They teach you about drugs, sex education, and PSHE, but they don't teach you about mental health and the problems that come with it. So if they started teaching these issues, and then they could start seeing alarm bells, tackle it early, and CAMS wouldn't be under so much pressure and strain, because so many people are, every schools, colleges, they're all just saying, right, go to CAMS, go to the GP, go to CAMS. Everyone's going to CAMS, whereas CAMS can't manage that. If you tackle it way before then, we start to see the lists hopefully drop, and people Go on.
Yeah. No, sorry. Sean, I just wondered that whole sense that George is reminding us about the importance of intervening early, which of course is not only better for the kids, but much, much cheaper. I mean,
Yes,
massively
exactly.
cheaper. We know that actually only the change in numbers, you've been very open that there's not going to be a huge more children getting help. It'll go from 1 in 4 to 1 in 3, I think, at the end of these 5 years. Will there be a move to early intervention as part of that, do you think? Or will it remain in the specialist services? Because, there's this kind of funnel for children that everyone's going to the special. It's been left till crisis, and clearly if it can be helped earlier, then people will be in a much better position to be able to avoid that.
Exactly.
Yeah, I mean, I totally agree that there's always a risk, and history says that we do put money into services sort of further on down the line when we should be putting money into prevention. What I see, the small amount of money that has gone into the services in this plan, when I go and see NHS Trust, they are working with GPs, they're trying to put some services in primary care, they're trying to pick things up a little earlier. The place we need to implement it in scale for prevention is schools,
Yep.
And we know that there's a government plan. Now that needs to be resourced. I mean, that's what we'll be looking for, to ensure that there's resources there, that we can get some specialists to help the teachers at early intervention in school.